So yes, ma'am, we are on live, ma'am, and we are starting the session. Ma'am. So very good evening, doctors. I'm Dr. Stalin on behalf of Shield Healthcare, welcoming you all for today's webinar. So the topic for today's session is a non-hormonal treatment for menopause. So I would like to welcome all the audience for their active participation, and I request them to post their queries if any is there in the chat box so that we can have a short Q&A session at the end of this presentation. Now it's time to introduce our invited speaker for the day, Dr. Kamal Kakar ma'am. Madam has done her MBBS and DGO. Madam is currently practicing in Raj Rani Hospital for the last 18 years. So Madam is having a very wide experience in the field of gynecology. And Madam is also the executive member of IMA Bareilly and BOGS. So with this short introduction, I welcome you, ma'am. I'm handing session to you for the further proceedings, ma'am. The platform is yours, ma'am. Thank you. Bharat, I think there is some internet issues with the madam. Can you just check with the?
Yes, ma'am. Doctor has left.
Yeah, sure.
Yes, ma'am. Ma'am, you can share your screen and you can start your session.
Okay.
Welcome, ma'am.
Still again having problem in screen sharing.
Sir, can you share the screen?
Yeah, I'm just.
सर आप शेयर कर दीजिए प्लीज स्क्रीन को.
Wait.
Yeah. If there is any technical issue, ma'am, फिर हम लोग share कर देते हैं. That would be.
Technical issue on my part. We are poor at technical things. I mean, I had a dry run just now.
शो नहीं कर रहा है वो यहाँ पे.
हाँ, I mean, just please give me a moment.
Yeah,
इसको
ma'am.
नहीं फिर वापस इसको बंद करके. हाँ, इसको इधर शिफ्ट करिए. मेरे यहाँ पर है ना ये. हाँ, करिए. ठीक है. So can you see my screen now?
No, ma'am.
No.
No, ma'am.
Okay. So apart from our academics, I mean, this gives us a opportunity to learn about this also. Now, is it visible?
Yes, ma'am. It is visible.
Yeah.
Yes, ma'am.
Okay. So the participants are here. Should I start?
Yeah, ma'am. You can start, ma'am.
Okay. Good evening, everyone. Sorry for starting a bit late.
Ma'am, make it full screen.
Okay. F5.
Ma'am, on the top of the screen, you have this slide share mode, ma'am. Slideshow. Yeah, ma'am. Format, view, review, and slideshow is there, no, ma'am? On the left of the side. Now you are in format, ma'am. View, review, slideshow is there. You can just click on the slideshow.
Maximize कहाँ से करना है इसको?
No, ma'am. The top of the slide, ma'am. Your arrow is now in. Yeah, ma'am. This side, light bit above, ma'am.
Slide.
No, ma'am. To the top. Home is there, no, ma'am. Home.
Home.
Insert, design, animation, slideshow is there, no, ma'am. Fifth option.
Insert.
No, ma'am. Home, insert. Yeah. No, ma'am. In the last one, slideshow is there. Design, animation, and slideshow. Yes, ma'am. You click on that. Yeah, ma'am. Start from the beginning, ma'am.
So this is the first.
Ma'am, there is
the first slide. This is the first slide.
Ma'am, there is an option called no from beginning.
From the beginning. Below, ma'am, just come below to the left corner. You have an option called start from the beginning. Little bit above, ma'am. Go up, ma'am. Yeah, yes, ma'am.
Yes, ma'am.
Okay. So it's okay now? This is fine?
Ma'am, please click on that again, ma'am. From the beginning.
So I have clicked on this is the first slide I have, non-hormonal treatment and by Dr. Komal Kakkar. Okay, this is the first slide.
Yeah, ma'am, I can understand this is the first slide. Okay, ma'am, you can just move on, ma'am.
Should I start?
Yes, ma'am, you can start.
Yes, ma'am.
Good evening, everyone. Welcome to today's evening talk. Welcome, seniors, my dear colleagues and dear juniors. Today, I'll be talking about non-hormonal treatment for menopause. Now, how do you define menopause? Menopause is defined as when patient is on her cycles, but is still having vasomotor symptoms, or she's having infrequent light bleeding after the age of 48. She's having amenorrhea for more than 3 months. There's a permanent loss of menstruation or presence of vasomotor symptoms in a woman above the age of 51, regardless of the fact whether she's having her period or not. Now, what is the straw staging? Where a woman is on her reproductive cycle when she is having regular or slightly variable cycles. She has normal or slightly raised FSH. She is in the transition or the perimenopause stage when the cycle variability is more than 7 days, or there are skip cycle, 2 or more skip cycles. Her FSH is raised and AMH is normal. In the postmenopausal stage, there is a complete cessation of menstrual cycle. Follicular stimulating hormone is markedly raised and AMH is low. Now, what happened to the serum hormonal levels at menopause? The circulating estrogen to androgen ratio, sex hormone binding globulin secretion all decrease. There is increase in the peripheral aromatization of dehydroepiandrosterone to estrone. There's a reversal of estradiol to estrone ratio, but no significant change in the testosterone level. There is a marked loss of follicles. Now, what are the menopausal symptoms we inquire when the patient comes to us? The patient complains of these symptoms. The cessation of menstrual cycle, the perimenopause or the menopausal transition is the time from the onset of menstrual changes till 1 year after complete cessation of cycles.
Ma'am, excuse me, ma'am, the slides are not moving, ma'am.
Now?
No, ma'am, it's not moving.
But I don't know, on my screen it is changing.
No, ma'am, it is not moving. Slides, sir.
But I don't know what's the matter because on my screen it's completely moving. Up, down, all the scribes are moving. Should I start again?
Yes, ma'am, that will be better, ma'am. You can just stop sharing and restart, ma'am.
Madam, just stop it. Again, start karke the where you stop. No, from there you can start, ma'am, again.
Stop share kar diya maine.
Yeah. Again, you please share, ma'am.
Now is it moving?
Ma'am, don't click on the picture, ma'am. Click on the slide, ma'am. You have clicked on the picture, ma'am.
I'm clicking on the up and down arrow on my keyboard.
Okay, ma'am. Ma'am, just click on the second slide now, ma'am.
No, is the slide moving? Can you see the slides moving or not?
No, it's not moving.
Ma'am, first slides is visible only. Ma'am, you can click on second slide.
Okay, just a minute. So, but okay, now did it move?
No, ma'am. It is not moving.
Now?
No, ma'am, it's not moving, ma'am. Ma'am, you just click on the second slide, ma'am.
So I did click. I can just see one slide at a time on my screen. And I'm clicking on the slide and my slides are still moving. So can you do that? You start the screen sharing and I'll speak.
Yeah. Bharat, do you have the slides with you?
Wait a minute, ma'am, we are doing.
Yeah, that will be better.
हाँ ये मूव भी कर रही है स्लाइड पे क्लिक कर रही हूँ इस पे भी देखें इस पे क्लिक कर रही हूँ तो भी मूव कर रहा है तो यहाँ से भी कर रहा है और यहाँ से भी कर रहा है पावर पॉइंट ना ये केवल एक ही है ये खोलिए इसमें वो करिए स्लाइड शो था ना ये करना है रिज्यूम स्लाइड शो now is it moving or not?
No, ma'am, it's not moving, ma'am.
I don't know. On my computer, both the ways it is moving.
I will share it the screen. Share.
Yes, ma'am. Now it's visible, ma'am.
Okay. So you will be moving the slides then?
Yes, ma'am.
Yes, ma'am.
So next, please. Okay. So menopause is defined as when the patient is on her cycles but is having vasomotor symptoms, or she's having light infrequent bleeding at the age of 48. She has more than 3 cycles skipped, a permanent loss of menstruation, or the presence of vasomotor symptoms in a woman of more than 51 years of age, regardless of whether she's having her menstrual cycles or not. Next, please. So this is the straw staging system. A woman is said to be in her when a woman is in her reproductive cycle, she has variable to regular cycles. Her FSH is normal or slightly raised. During the transition or the perimenopause, the cycle variability increases to 7 or more days. She has 2 or more skip cycles and her FSH is raised, AMH is normal. Post-menopausal age, there is a complete cessation of menstrual cycle, her FSH is raised and AMH is low. Next cycle, please. What happens to the serum hormonal levels at menopause? The circulating estrogen to androgen ratio, sex hormone binding globulin all decrease. but the peripheral aromatization of dehydroepiandrosterone to estrone increases. There's a reversal of estradiol to estrone ratio, but no significant change in the testosterone level. Next. There's a marked loss of follicles. Next. What are the menopausal symptoms patient come to us with? Menopause is the final menstrual period. The perimenopause or the transition time is the time from the onset of cycle variability till 1 year after the final menstrual period. Changes in the vaginal bleeding pattern, vasomotor symptoms are characterized by the transition, are experienced during the transition period, but the overall experience is highly variable and is influenced by the psychological, social, and cultural factors. The vasomotor symptoms encountered are hot flashes and night sweats, genital symptoms like vaginal dryness and dyspareunia, which are accompanied by mood disturbances and sleep disturbances. The physical and psychological symptoms are quite often interrelated. And the belief about menopause and her esteem and our expectations influence quite a lot to what amount of symptoms she is experiencing. Next. Next. What is the etiology of menopause? It is a normal phenomena, which is follicular exhaustion. It may be iatrogenic by surgery, radiation, chemotherapy. It is premature when it occurs before the age of 35 years. It may be genetic, autoimmune, or idiopathic. Next. What are the key points to consider whenever we start a patient on menopausal treatment? Menopause is a normal event, but 25% of the patients encounter problematic vasomotor symptoms enough to hamper her quality of life. HRT is currently the most effective treatment for vasomotor symptoms, and they also improve the vaginal dryness, sleep, and the quality of life. Patients who wish to avoid HRT, we also have non-pharmacological and non-hormonal pharmacological treatments available. Most of the non-hormonal treatments act quickly, so there is an improvement in 2 to 4 weeks. If we do not get improvement in 2 to 4 weeks, we should consider changing the modality of the treatment. Management of menopausal symptoms should always be individualized, and we should address the patient aims, and it should target the symptoms which are most affecting her quality of life. Next. What are the other problems accompanying menopause? The vasomotor symptoms, coronary heart disease, breast cancer, osteoporosis, urogenital atrophic symptoms, and dementia. Next. So what are the factors that increase the risk of osteoporosis? These are personal or family history of fragile bones, early menopause, she has a family history, she's addicted to something, low calcium intake, sedentary lifestyle, and if she's on medications like glucocorticoids for a period of more than 3 months. Next. So how can we, what are the preventive measures we can take for it? First and foremost is the lifestyle change, weight-bearing exercises, stopping all kind of addiction, nutritional changes, calcium, vitamin D supplementation, and medications like biphosphonate and estrogens. Next. Coronary heart disease. This is the leading cause of death, and the risk for women is much lower until menopause, after which it rapidly approaches the risk of men. A large number of studies have shown the beneficial effects of estrogen on cardiovascular health, and it has been seen that estrogen therapy may result in reduction in CHD about 50%, about 50% reduction in the risk. Next. A women's health initiative conducted a multi-trial placebo-controlled randomized trial in which one group of patients was given low-dose equine estrogen 0.6 to 5 milligram and 0.25 milligram of medroxyprogesterone acetate. The study was stopped after 5 years, but because of the excessive risk of breast carcinoma. Next. So this was the result. The events considered were coronary heart disease, stroke, embolism, breast, colon cancer, and hip fracture. And this shows the events per year in 10,000 patients. These are the events that occurred in patients given HRT, and the events number of patients undergoing events in the placebo group. Next, so you can see that these results were conflicting with the biological and in vitro data. Nonetheless, use of HRT in older women for longer period of time increases the risk of breast cancer and coronary heart disease. So the dictum was that estrogen forever. This no longer holds true. Next. Now a case study for non-hormonal therapy. A 50-year-old patient is there. She is having severe vasomotor symptoms for several months, and she wants some treatment for it, but she is also anxious because she has read that estrogen therapy increases a risk for breast cancer, carcinoma. So she is right about it. Non-hormonal therapy is much safer for her. And the risk of breast cancer will be minimal if she uses a non-oral estrogen therapy, and it will be further minimized if she adds a progesterone to it. Next. Now, what are the contraindications for HRT? There are absolute contraindications and relative. Absolute is if at present she is already having some breast cancer or endometrial cancer. She has a past history of these cancers. There's an undiagnosed vaginal bleeding. She's already pregnant. She has an acute or chronic liver disease. She has active venous thrombosis or thromboembolic disease. Relative contraindications are she has previous history of embolism or a thrombosis and a strong history of family history of breast cancer. Next. So what are the non-hormonal therapies available to us? For vasomotor symptoms, we have clonidine, SSRIs, herbal estrogen, and vitamin E. For coronary heart disease, we have statins, aspirins, and the patient should be on controlled hypertension. Diabetes should be controlled. She should be advised diet, exercise, stopping all kinds of addiction. For osteoporosis, we have serum estrogen receptor modulators, biophosphonates, calcitonin, calcium, vitamin D, exercises, and giving up all kinds of addiction. Next. Treatment of menopause. Whenever a patient comes to us, when we are thinking of giving her treatment for menopause, what are the issues we should consider? What's her age, her menopausal status? The potential of duration of therapy will be giving, severity and the impact of symptoms, what is her lifestyle, and what is the likelihood that she will take to your counseling and compliance about changing her lifestyle, because this is the most difficult thing to start, change in your lifestyle. Is she on any addictions, smoking, alcohol, whether she's getting any exercise, if she's has any other medical problems like diabetes, hypertension, is she on any other medication, what are her risk factors for coronary heart disease, risk factors for breast cancer, osteoporosis, deep vein thrombosis, what is her family history, what is the likelihood of compliance with medication, what is the patient tolerance to the risk, and what is the cost of the treatment. Next. What is the current situation with HRT? Estrogen replacement is safe and effective in most women for at least 5 years when begun early at menopause. It should not be given to women who are increased risk of coronary heart disease, breast cancer, DVT, deep vein embolism, and women over 60 years. The risk of coronary heart disease and breast cancer increases with the age and with the duration of HRT. So the lowest effective dose should be given for the shortest period of time. Next. HRT should not be used without a clear indication and careful consideration of all the risk-benefit ratios. FDA has approved HRT for relief of vasomotor and vulvovaginal symptoms and prevention of osteoporosis. Non-oral routes are preferable to avoid DVT, and benefits may also be achieved with non-hormonal therapy. Next. What are the non-pharmacological treatments available to us for vasomotor symptoms? Cognitive behavioral therapy, hypnosis, relaxation, lifestyle changes, exercise, diet, supplements, yoga, and weight loss. Next. What are the complementary and alternative treatments available for vasomotor symptoms? The most popular ones are herbal medicines, soya, phytoestrogens, evening primrose oil, relaxation, yoga, and acupuncture. Next, please. There is another modality, stellate ganglion block, but this is an invasive and costly procedure, and still the trials are going on. So this is not yet recommended for vasomotor symptoms. Next. There is another one, serotonin selective reuptake inhibitors and serotonin and noradrenaline reuptake inhibitors. So this is also, these pharmacological treatments are still undergoing trial and they are not yet recommended for vasomotor symptoms. Next. So this is a comparative chart where we compare the non-pharmacological therapy, the pharmacological therapy, what is the reduction in the frequency and severity of vasomotor symptoms, and the additional benefits of it. So here we can see that the reduction in the frequency and severity is certainly much more in pharmacological therapy as compared to non-pharmacological therapy. But on the other hand, they are always accompanied by side effects which are not present with non-pharmacological therapies. Next, please. So again, these are the various pharmacological, numerous pharmacological agents available to us. They have other benefits, and there is about 50 to 60% improvement. But as I said previously, they are all of them are accompanied by variable side effects. Next, please. Now, what are the medical alternatives available with us? These are tibolone. This is a synthetic steroid. Clonidine is useful in patients who have a history of breast carcinoma. SSRIs can reduce vasomotor symptoms, but these are still in the trial phases and they are still not recommended for vasomotor symptoms. Gabapentin, progesterone, Replens, all of them are available to us, but these are infrequently used. Next. Next slide, please. Yes. So this is again the repetition of the chart we have seen, that how do you manage vasomotor symptoms with non-pharmacological treatment and pharmacological treatment. Various pharmacological treatment in dosage are there, but as I repeated previously, they are always accompanied by side effect, and the patient compliance is to be considered for giving pharmacological treatment for such a long duration of time. Non-pharmacological treatment and changes in lifestyle are always better and are not accompanied by any side effects. Next. Now, non-hormonal pharmacological treatments. These available are the various herbal preparations available to us are phytoestrogens. Next. Isoflavones, lignans, comistans. Now with isoflavones, it was very popular for treating postmenopausal symptoms, but the effect on hot flashes is very variable and inconsistent. There is only modest and delayed improvement of the symptoms. Next. For hot flashes, there was a publishing in Journal of Women's Health in 2007 that substituting soy nuts for non-soy proteins consumed 3 to 4 times a day is associated with a decrease in hot flashes and improvement in the menopausal symptoms. Next. Now, natural herbs and remedies available are phytoestrogen, black cohosh, progesterone creams, and acupuncture. Next, please. There are various medical herbs which are extract from the roots of various plants. These are the various herbs you can see. Next. These have shown promising results. Next. Now we have a product available to us, presented by Shield. This is Estro G100. This is a balanced feminine formula. It is extract from 3 kinds of roots. Next. Now, do we have, what are the effects of Estro G100 in perimenopause, menopause, and postmenopausal group? It regulates the estrogen affinity to estrogen receptor. So what is so special about this regulation of estrogen affinity? The edge we have with Estro G100 is that it upregulates the estrogen affinity in the non-reproductive target organs, that is the vasoendothelium, the CNS, and the bone. So it helps in reduction of the vasomotor symptoms. It improves the mood swings and it improves the BMD. But on the other hand, it down-regulates the estrogen affinity in the reproductive target organs, that is the breast and the endometrium. So the risk, there is no risk of malignancy. So this is the advantage, that it is acting on the target organs where we wish to control the menopausal symptoms, but it is not accompanied by any of the dreaded side effects. Next. So what are the evidences? So it has been seen that there is a significant reduction in the Kaplan index, the vaginal dryness, hot flashes, mood swings, bone pain. The symptoms are relieved within 7 to 14 days. Next. A randomized controlled trial was conducted in 2 groups. One was given Estro G100, one was given placebo. The Kaplan menopausal index that evaluates 11 symptoms. So it was seen that there was significant improvement in the group that was given Estro G as compared to the group that was given placebo. Next. So this is the evaluation of effectiveness and safety in giving Estro G100 in perimenopausal women for 1 year. The osteocalcin or alkaline phosphatase, these were reduced, while the bone mineral density was seen, there was seen a significant increase in it. So this study demonstrated that improve in the bone health parameters was there significantly. Next. So we can conclude that Estro G100 for 12 weeks significantly improves the quality of life. The most important symptoms of hot flash, night sweat, paresthesia, mood swings, vertigo, melancholia, these are significantly improved. There were no, and most importantly, there was no side effects reported in the group having Estro G100. So here we have a win-win situation. We have a safe, effective herbal formula that improves the quality of life and various other menopausal symptoms. But on the other hand, we are encountering no side effects with it. Next. So thank you for the patient hearing. I conclude my talk. Thank you, everyone.
Thank you, ma'am. Thank you very much for that wonderful and detailed presentation, ma'am. Yeah, ma'am. Hope the participants would have been enjoying the webinar, ma'am. Ma'am, let me wait for 1 or 2 minutes for the participants to post their queries, ma'am. If there is any queries, then I'll read it for you, ma'am. Ma'am, whether this Estro G is safe for a woman who has undergone this hysterectomy, ma'am?
Yes, certainly, because you see, as I told you, it is acting on the non-reproductive target organs. So the uterus has been removed, hysterectomy, you can safely give it. In fact, after surgical menopause, there is sudden cessation of period. So the menopausal symptoms are quite a lot, very exacerbated. Some women undergo quite exacerbated vasomotor symptoms. So even in my personal day-to-day experience, while prescribing Estro G100, I've seen it shows a marked improvement. It's quite helpful.
Okay, ma'am. Thank you, ma'am. Ma'am, is there any side effects have you ever monitored or ever any area reported in your practice?
I am yet to see any patient coming back to me with complaints of any side effects associated with it. I have not encountered it in my personal practice.
Okay, ma'am. Ma'am, when they are using this HRT treatment, when they are suddenly withdrawing, there may be some adverse effects, ma'am. Is that a good idea to use this estrogen with HRT and gradually tapering the dose, ma'am, so that that hormone?
Yes, certainly. But frankly speaking, I use HRT very rarely, because you need to go under, we need to investigate a patient thoroughly before starting a HRT. And the patient should be on regular follow-up, and those investigations have to repeated quite frequently. So, itna zyada compliance Indian patients is very poor, that repeatedly they are coming and getting investigated. So I prescribe HRT with very cautiously. And when I'm very sure that patient is really going to come on regular follow-up and she will get all the investigations done. So HRT is, I mean, very rare. I usually recommend lifestyle changes, weight loss, change in the diet, and I prescribe herbal preparations like Estro G100. I prefer that much more.
Thank you, ma'am. Ma'am, how to treat this genitourinary syndrome in menopause, ma'am?
Genito. So these herbal preparations also help in genito, and you can give some local applications also. There are creams available, so they help in genito urinary symptoms.
Okay, ma'am. Ma'am, is there any symptoms that the woman is reaching her early menopause, ma'am?
Early menopause, vasomotor symptoms are the symptoms that start the earliest.
Okay, ma'am. Ma'am, is there any relation between these thyroid hormones and these reproductive hormones in postmenopausal woman, ma'am? Is the whether this thyroid plays any role in that woman type of woman, ma'am?
So thyroid should be regulated in whether the patient is in reproductive cycle. Even if her thyroid is uncontrolled, she will have symptoms because of it. And thyroid should be in the proper level in reproductive age group women as well as the postmenopausal. But I don't think hypothyroidism exacerbates postmenopausal symptoms. I don't think so, in my opinion.
Okay, ma'am.
But yes, it does happen that when a patient with menopausal symptoms is coming to us, she's investigated and there is an incidental finding is that she's also a hypothyroid. So she starts to get treatment for that also. So some of her symptoms like body ache may be related, because usually the females do not undergo regular checkups in our country. So when she's coming to us with complaints of menopausal symptoms, we investigate her and there is an incidental finding, yes, that patient is also hypothyroid. So body ache and weight gain may be because of hypothyroidism also, apart from menopausal symptoms. So we start both the treatments side by side, but hypothyroidism exacerbating menopausal symptoms, I don't think so.
Fine, ma'am. Ma'am, you are using this estrogen for quite long time, ma'am. So how beneficial it is and how it is improving the quality of life in a woman, ma'am?
I have seen quite the improvement is certainly good. Patients do come within 2 weeks. There is marked improvement in her symptoms, and when there's improvement in symptoms, yes, there is improvement in quality of life also.
Thank you, ma'am. Thank you very much for addressing all those queries, ma'am.
Thank you for
ma'am. I don't find any other questions in the chat box, ma'am. So if you allow us, then we can.
So I think I spoke very well. Nobody had any queries.
Yes, ma'am.
That's a compliment.
Yeah, ma'am. Thank you, ma'am. If you allow us, then we
Thank
can end the webinar today, ma'am.
Thank you.
Thank you, ma'am. Thank you very much for spending your valuable time with us today, ma'am. And I will also like to thank the audience for their active participation, ma'am. And ma'am, we are looking for many more webinars with you, ma'am. Please do support us through your webinars, ma'am.
Sure.
Thank you, ma'am. Thank you very much.
Thank you. Thank you.
Thank you.